We're now on to part two of the day, and we're going to start thinking about identifying and supporting people's needs, and we're going to be doing that mostly through some group discussion. Before we do that though, I'm just going to tell you a little bit about the Tower Hamlets Living with Cancer programme, which Serena and I are working on, and a little bit about some of the engagement work that we've done, and then we'll get you into some group activities. So Serena and I work on something called the Tower Hamlets Living with Cancer programme. Both of us are employed by Tower Hamlets Council, and you'll usually find us either at Albert Jacob House on Bethnal Green or Mulberry Place in Blackwall. And we're working on a programme which is funded by Macmillan, the cancer charity, and they've given us £1 million over 3 years. And what we're doing at the moment is we're thinking about how we could use that money, what we could invest it in to really transform quality of life for people affected by cancer in this borough. So that's adults and carers and family members with any kind of cancer diagnosis, and that's from the point of diagnosis through treatment, finishing treatment, living with and beyond cancer, people who have cancer which is treatable but not curable, the full range really. And we're thinking about how cancer impacts on a person's entire life. So from their emotional well-being, the physical consequences they might be living with, sometimes for months and years after diagnosis and treatment, through to the impact on their personal finances, on their housing, on their family life, their needs for support around the home. So we're really looking at the full different range of the ways that it can affect people. And what we want to do is we want to bring together people who work in the NHS, in the hospital, people who work for primary care, in GP practices, adult social care, community health services, the voluntary community sector. And we want to think about how all these different people play a different and complementary role, and how we can all work together better to support someone with cancer, and to think about that in a really kind of non-medicalised and much more holistic way. So Tower Hamlets is one of 5 pilot sites that's doing this across the country, and we're the only one in London. So it's a really great opportunity to do something pioneering, and that puts us ahead, I guess, of the rest of the country. And the other important thing to say, I think, about this is that yes, we're thinking about cancer and we're funded by Macmillan, but actually we're thinking about long-term conditions more broadly, and we're thinking about the kind of personalised care that people with long-term conditions need. So in a way you could substitute the word cancer for asthma, for diabetes, for COPD, and indeed many of the people we're thinking about are also living with some of those conditions as well. So that's a little bit about us. I also thought it was just important at this stage to remember the pathway that people with cancer go through, and to think about how their needs might change at different points. So as we've discussed, at the point of diagnosis, of course, emotional well-being might be the thing that people most want to talk to you about and feel they need most support with. As somebody goes through treatment, then they might start to experience kind of impact on whether they're able to work, how much money they have, whether they can pay the rent and the bills and that kind of thing, whether if they're feeling very physically weak, if they need more support at home. And indeed, after they finish treatment, people often say in the months and years after that that they are still feeling depressed, anxious, that they are experiencing the long-lasting impact they might have had from some quite radical surgery, or fatigue from chemotherapy, or impact on their cardiovascular health. So I think it's just important to keep in mind that we're not expecting you to be an expert, as Tanya said, in all of those things, but just that people's needs do change over time. So this picture here is really just to illustrate what we talk about as the team around the person. So it's just to kind of show the huge variety of different people and professionals that might be involved in supporting somebody with cancer. And obviously I love dogs, I'm a dog person, so I think that the dog is a really key and important part of the emotional well-being that's involved. But it is to kind of show, you know, the people that you're interacting with as professionals, the number of other people they might have appointments with, they might be visiting, and actually that could be quite overwhelming and sort of give that person a bit of a disjointed experience as well, if we're not working in a really coordinated way. And I put some people in green and some people in red, and that was to highlight the red people are the clinical people and the green people are all in non-clinical roles. So actually, a lot of the support that a person in need of is non-clinical as well. And I think the really important part of this to take away is that communication and conversations between all of these different professionals is really, really key. And if these people aren't all talking to each other, aren't all sharing care plans, aren't letting each other know what's going on, then what we're going to end up with is a lot of duplication and a lot of kind of a disjointed experience for the person with cancer. So I just wanted to share with you some of the findings from the engagement work that Zarina and I have been doing as part of our programme. So we did 5 focus groups in the borough, and we spoke to over 48 people who live locally who've had experience of cancer, either themselves or as a carer or family member. And some of the things that they said were most important to them was that it was really, really hard to get information, that they weren't asked about what their needs were in a systematic and holistic way by professionals. So some people had a great experience, some people had a great experience when it came to asking for financial advice, but not when they needed support from adult social care, for example. So there's huge variation. A lot of people said that emotionally one of the most difficult times was actually when they finished treatment and were discharged from the hospital. And although the people around them might expect that they'd be really happy to have come to the end of successful treatment, actually that was the time that they felt like they were let go of, and that they'd come out of the sausage machine, was the way that a lot of people described it. People talked about really severe impact on their personal finances. A lot of people who were renting privately in the borough found that that was really hard. They didn't perhaps anticipate right at the start that they might not be able to continue working throughout treatment, and that could be really difficult, particularly if they didn't have a partner or a family member who could support them with that. And a lot of people talked about feeling socially isolated and lonely, either because they didn't have a network of family and friends, or just because the experience of having cancer itself made you feel really isolated and as if other people didn't really understand what you were going through. And I think finally the most important point from this to take away is that people really need support to make best possible use of the services that we do have in this borough. So people were aware of some of the things that were out there at Bromley by Bow Centre or at the Poplar Harker housing associations or the idea stores, for example. So great resources that we're really blessed with in this borough. But having the confidence to go out there and to go to a support group for the first time, or to pick up the phone and ask to book something, to follow up when you don't hear back from someone that was supposed to get in touch with you, to be able to digest all the information, it was really, really difficult for some people. So having access to a social prescriber or a care navigator or somebody like that that can help you to find your way through the system is really important.